We do start with some sobering news regarding COVID. Children are being hospitalized at levels we have not seen during this pandemic thus far. Cases are surging among kids under the age of 5, the group not yet eligible to get vaccinated. According to the CDC, that age group is seeing a 48% increase since last month. Now, the highly contagious Omicron variant is spreading fast nationwide. Take a look here at this map. It shows the levels of community spread. Nearly 2/3 of the eligible population, everyone over age 5, is fully vaccinated. But is that enough? Here's what President Biden said yesterday.
No, I don't think COVID is here to stay. That having COVID in the environment here and in the world is probably here to stay. But COVID, as we're dealing with it now, is not here to stay. The new normal doesn't have to be. We have so many more tools we're developing and continuing to develop that can contain COVID and other strains of COVID. The new normal is not going to be what it is now. It's going to be better.
President Biden there speaking about the future. What will the new normal look like? He said better. Experts say because of the rapid spread of Omicron, if you have COVID-like symptoms, you should assume you have COVID. And the CDC is coming under fire for what many are calling confusing COVID guidelines. Take a look here at this clip from The Daily Show on how confusing it can be.
If you test positive for COVID, you only have to isolate for 5 days, 5 Martian days. They're slightly longer than Earth days, so that probably helps. If you test negative, but you're an Aries or any other fire sign, test again. Your immune system is a free spirit, so the tests have trouble detecting COVID. If you can't find a test, get a strong scented marker and see if you can smell it. If you can't, you probably have COVID. Oh, this is probably unscented. Count 5 days from when you last had symptoms, then take the name of your childhood pet and the street you grew up on. That is your porn star name. Remember this rhyme. If symptoms again, the days are 10. If you're symptom free, the days are through 5. If you still wear a cloth mask, you've already died. I know it seems confusing, but by following these simple guidelines, we can finally beat smallpox.
COVID-19.
COVID-19.
That obviously in jest there, but the messaging is not clear to many people. Want to bring in internist and pediatrician Dr. Frita Fisher. Dr. Fisher, always good to see you.
Good morning, good to see you.
And a happy new year to you. Considering we're still going through this, no one knew 2022 we'd be dealing with this and the mixed messaging. Should people just go with their gut, trust themselves, rely on how they feel and testing here, considering the messaging?
No, Susan, people should not just go with their gut. They should still go with the science. And it's true, it's been very confusing. But the truth of the matter is that after 5 days, even though the new CDC recommendations are that you can come out of isolation or quarantine and go back into the world, yes, it's true that in the first 5 days, people are most infectious, like 85 to 90% most infectious. But according to a preprint UK study, after 5 days, 31% of the population is still infectious. And even after 10 days, 5% are still infectious. And so I want people to continue to wear masks, and certainly if you're symptomatic, still go ahead and quarantine and isolate. So not just going with your gut, but also going with the science, Susan.
Do you think because the symptoms are less severe, although it seems for those vaccinated not going for the lungs, as Dr. Fauci did mention, that this could be the beginning of the end, meaning that we can live without masks and we could live, let's say, back in 2019 like it was back then?
I just don't think we will be living completely without masks going forward. Because if you look at flu season last year, even though our target was not to prevent flu, we saw that wearing masks made us have a much better flu season. So I think we're going to be holding on to masks to some degree for the long term. But I want people to be careful about Omicron not being as severe, because yes, it does seem to just really affect the upper respiratory system, not so much the lungs. But it is affecting people in such a huge fashion, so transmissible. We're surging with hospitalizations, cases, and so forth, that even if only a small percentage of people with Omicron get very sick, a small percentage of a very large number is still a huge amount of the population that can overwhelm the healthcare system. Also, I'm concerned because Omicron is not the last variant. Just as sure as we have people in states lifting mask mandates, and now states such as Georgia lifting some of the contact tracing and lifting some of the quarantines, the viruses are going to have a chance to replicate, which will allow them to mutate. And so we can still see further variants. And so it's not over.
Yeah, I wish we were on the same page here to end this, because it is possible if we all work together. Always good to talk to you, Dr. Frita Fisher. Thank you.